Yeah, I think it's really dynamic to see that we have the guideline, but we cannot almost always adhere to the guidelines. And since we have covered a lot of technical things, the scientific things of the patient counseling and HIV/AIDS, now I want to go something more like a social thing. So one of the importance in patient counseling for HIV/AIDS is about the adherence. But can you briefly share the experience on what kind of issues what kind of issues that made patients in adherence, and how do you address that?
Okay, I think adherence is very multifaceted. So maybe I will touch on a couple of them in terms of uh, the different spectrum of adherence issues that I may commonly encounter. So first, I guess would definitely be things like social and economic, briefly as we have discussed earlier as well. So things like social stigma has always been an existing issue for patients, be it like staying committed to care or even approaching reaching out for treatment, or even though there's like such highly effective treatment options at the moment compared to maybe um, 20 years back or 30 years back when it was something very new and with high morbidity and mortality. So things like I guess it really depends on the cultural and the societal perception of this as an issue. Different countries have got different success rates in terms of promoting and advocating uh, HIV as something maybe as a common chronic disease, for example. As long as you know the mode of transmission, you are aware of like maybe the fact that undetectable equals to untransmissible. Things like that actually do help uh, the 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 confidence of our patients as well, in terms of their health seeking or even their sexual behaviors. So with that as a background, depending on their individual setting, maybe be it poor literacy, poor education, or maybe they have got issues with having some form of social support, or they might be have hustling and for things like employment or different priorities. So they might be plagued with various social economic kind of like issues that make it difficult for them to be or to stay committed to care, or to even access care in the first place. So I think what we do here is provide a very holistic kind of approach to managing our patients here. So one way is through our medical social workers. Each touch point, or rather each patient is usually tagged to a medical social worker who will assess the patient's maybe social coping, financial background, financial status to help assess is what kind of help we can offer to them in terms of more of like I guess the subsidy eligibility, and also providing psychosocial support if they need. So they can recommend things like support groups, and also provide some form of more active kind of engagement. Some of our social workers actually do go for house visits, and it's actually beyond. Sometimes it's also beyond HIV care itself. Also, sometimes if let's say they are plagued with other uh, maybe caregiving responsibilities, or and social situations that or social conditions that might not warrant uh them to be able to have the ability to maybe be it take time off from their work, take time off from their family even. Some of these existing issues will require a more concerted effort in terms of support. And we will have to take into consideration in terms of our provision of clinical services and care for the patient, understanding that these are some of the things that are important or are possible deterrents for them to stay committed to care. We might do things like maybe extending if they are generally adherent and they are independent in terms of taking care of their treatment. One way is to extend maybe the next follow-up appointment. We might not need to be seeing them that frequently, as opposed to maybe if they are poorly controlled and will require more frequent kind of monitoring. So typically, these are some of the um, issues that we do see patients having when they come to our clinic, or maybe the what we call um, patients who frequently maybe default our clinic service or consultations. So they are, and we try to help them as much as possible from the clinical portion, as well as in terms of the financial part and social support portion. So that's broadly on the social economic kind of background to some of these patients. So access to care, active engagement of the patient and or their family members, providing them with some form of community support with support groups. We do have this advocacy group called Action for AIDS in Singapore. We do have got this campaign that we do on an annual basis, also to raise awareness in community and in the society. There's this, so this 2024 was the last part of the three-part series of this persona named Jason, with on an annual basis, we have this campaign highlighting different aspects of HIV patients' concerns. So the first year, if I'm not mistaken, was on employment. The second year was on relationships, and the last one, which is the most recent, is about aging, which is HIV, which is I think the direction that we are focusing on in recent times as well. So because the life expectancy of our patients can be as long as someone who does not have HIV, as long as they are properly treated, they are adherent to care, and also they are biologically well controlled. So these patients have got equivalent life expectancy as any of their counterparts without HIV. So this is a big area that we are also focusing on, also to promote a bit more on education and advocacy in that sense. Then, of course, in terms of the healthcare system point of view, is definitely what the government can help in terms of like broadly. I think we covered earlier things like funding or subsidy for the drugs, as well as sometimes what we are able to do for the patient are limited by some of the healthcare system support. So Singapore, I think generally we're quite fortunate in the ability to access healthcare, but in some of the other probably some other countries where the infrastructure or the support of health services are not as established, um, which in turn results in probably poor medication distribution and access to some of these healthcare resources, then of course we might run into issues with patients being able to stay in care or to be um, well treated in that sense. Of course, not everywhere has got or rather each area in maybe in a country might not have the kind of infectious disease expertise. So that is also probably another healthcare system kind of barrier to um, adherence to the medications, because you are technically, if let's say it's more of a general practitioner or maybe someone not that specialized in this care, then the options or the discussions that you can have with the patients might be a little bit more limiting. And often this treatment options, we try to make it as open as possible in terms of the communication with the patients. Um, in terms of comorbidities wise, definitely as we have more issues, I mean the ability to adhere to treatment will definitely drop correspondingly. So if patient, especially if patients have got cognitive impairment or have got psychiatric issues, addiction issues, drug abuse, alcohol, or poorly controlled comorbidities like diabetes or whatsoever, then as a whole, their drug regimens are already very complex and very extensive in that sense. So we might have greater issues trying to get them to stay committed or to adhere to their medicines. But of course, what something we can do is to help them in their pharmacy if let's say there is an existing one with their various comorbidities, and also to prioritize for them which are the really essential treatments that they have to stay very committed to. And as pharmacists, this is the, I guess this is the bulk of what where we come in to help them, I guess, simplify regimens, to provide them with better understanding of what they are taking and why they are taking this. Um, most of this we will try to provide this reassurance that maybe at the start, some of this maybe side effect profile that they might be experiencing or complaining because uh, and as a result, they are not taking their medicines properly. We the reassurance is important. So sometimes we see patients with some of these side effects more obvious or more apparent at the start. And if let's say the counseling and the education is done well at the upfront, patients are able to anticipate some of these possible side effects that they might run into, and at the very least, they are not as thrown off or taken aback in terms of this aspect, which may be a potential obstacle to subsequent adherence to these medicines. So in terms of maybe back to the part about complexity of regimens, we can use adherence tools, be it pillboxes. I think there are applications, mobile applications now to help track adherence. So those will be helpful. Phone alarms as reminders, those can be helpful. And of course, maybe peer support, maybe family reminders or whatsoever would be helpful. As to kickstart maybe the habit or to build maybe a to incorporate it into their daily routine, for example, like first thing in the morning, or maybe putting in an obvious place their medicines, so that once they wake up, they will see it, or maybe just before bedtime, they see it at their side table next to them to remind them physically that they have to be taking their medicines as a physical reminder uh, for adherence. No? And probably the last part I would like to talk about is actually pertaining to patients themselves. So I think ultimately we want to try to empower patients and be to allow them to eventually be self-sufficient and be independent in terms of taking care of themselves. Lah. So our role eventually there at that point in time or at that state would be to address any concerns that they might have. Maybe be it things that they see online, things that they might encounter based on their friends who are also on the medicines. So dispelling some of these myths or maybe some of this false information will be important. And I guess for them to come back to you as a trusted like health professional would be a rapport that has to be built over time as well. So the ability for them to recognize what's important and significant enough to raise up to seek help. and to maybe ascertain or verify some of these things that they encounter along their way will be things that they will require, will require, I guess, consistent interaction and rapport with patients over time as we see them. So I think in terms of adherence, is really a very, very, very big topic. So under this umbrella of adherence, we as a summary is just mainly the socio-economic factors that we've mentioned earlier. Of course, there's the healthcare system that we mentioned about, which can help patients in terms of access to healthcare resources, and also be it like maybe government policies which can alleviate some of these cost concerns, be it helping to subsidize or into formularies, and also to ensure that they are able to are reassured in terms of some of these maybe side effect profiles, some of these comorbidities or complex regimens that they have, and to make it easier for them to understand as a package. I mean, it may not be uh, also easy sometimes, but I guess compartmentalizing for them and providing clarity does help to an extent.
So
Yeah.
maybe another question regarding the patient itself. So managing the side effects of some medications can
Yeah.
be another hurdle for the patients. So how
Mm.
do you navigate these issues while also managing the patient's expectation about their long-term outlook, especially to motivate them to continue taking their medications?
So I think briefly I probably did mention earlier. I think the idea of getting them to adhere to medicines based on the risk of toxicity or adverse effects is important at the very start. So providing that kind of reassurance that and at the start, and providing that anticipation for them so that they know that of course sometimes when you are explaining some of these possible side effects, it may sound a bit intimidating for them at the get-go, but I think at least from my interactions, as long as you are able to highlight to them the way for them the risk benefit profile, and also definitely the that I mean the maybe the chances of it happening, and the very fact that the adverse effects, if let's say they can be accompanied with some other actions, be it maybe taking certain things after meals, for example, to reduce gastric related side effects. What we can propose might be things like changing dose timing. For example, the patient is getting very bad drowsy, giddy spells from the neuropsychiatric side effects of maybe the NNRTIs. Then possibly you might want to switch the time of the medicine to maybe at night. So you can customize based on what the patient uh, is experiencing. And if we are talking about on the get-go, will definitely be reassuring and providing that anticipation for the patient, so that he or she is able to uh, monitor for those specifically, and also to highlight or have that ability to come back when they have to, when something severe happens to them.
So staying updated on the latest treatments must be crucial in your field. And how often do you need to update your knowledge on new HIV/AIDS therapies? And how is it typically standardized, whether it is locally or internationally?
Okay, that's a good question. So, when you're practicing, I guess um it is good to have regular updates, be it from your colleagues, for example, when we notice that a certain like maybe management treatment uh is updated, for example. It can be in the form of like continuing education, like maybe have one of your colleagues or maybe yourself do a presentation on the updated guidelines, for example. we do have department meetings to also share about complex cases and possibly updates in terms of guidelines, especially if there are major ones in which will change our practice on the ground. On top of that will definitely be things that go through our drug and therapeutics committee. So those will determine what are the new additions to our formulary, for example. So if let's say we have a new drug that is brought in because it's more consistent with the updated guidelines, then definitely those are things that you want to inform the whole department, or maybe let everyone be aware that there's this new drug that, or rather this is the new practice moving forward in terms of our setting. Then, of course, there are some drug companies which will approach for continuing education as well. They will probably provide some evidence updates to the either a new drug or maybe some of the newer trials that they have conducted and are trying to probably advocate for push for new indication in practice, or maybe it's possibly something that is newly registered in Singapore. So those are some of the considerations when we are talking about updates to our practice.
Interesting thing that you mentioned is that for the whole department, there can be like some meetings. Is that like, are all of the members of the department is required to attend those meetings, or is it optional for you?
So it actually is optional. I mean, as much as possible, we try to, as long as time allows for it. So, during those meetings or updates, usually, we have a interdisciplinary audience. So we have got our nurses, we have pharmacists, we have social workers. Sometimes we bring in also additional guest speakers, like maybe consultants from other practice or disciplines, maybe endocrine, geriatric, psychiatry, to see how maybe if the infectious disease consultants are the primary physician for their other chronic diseases, then if there's any more complex cases, they can also share how we can manage these patients. So that's one. Of course, different consultants also have got different practice and experiences. So even for, I mean, for example, a more complex or complicated case, the attending physician might not always have the most experience managing that particular complication, for example. Maybe some other consultants, if let's say they are in the same meeting, they can offer their previous experiences and also their insights to their practices previously, for example. And then in that meeting, we do have also like mentioned, pharmacists, we have social workers. So depending on the topic for that particular week, we might be also roped in to provide some inputs for holistic management of that patient, as well as if let's say there's a specific area of interest, be it drug related or maybe social related. Sometimes the speakers can be the allied health professionals as well.
Okay, hi, Jun Xin. So thank you for covering all. There's a lot of information that we can learn from today, and I think you also cover quite a lot of grounds on, I think, the pharmacist's role. I think especially in empowering the patients in their medications and the usage. But I think I'm more curious as well, because like I mean, as bread and butter of a pharmacist's role is drug adherence. But I think maybe in a bit more personal issue, especially maybe with HIV AIDS management, do other patients that have a poor outlook in life, and maybe especially things like life expectancy, and how do you, either by yourself as a role, maybe in your day-to-day, if you see this, or maybe in conjunction with a medical social worker, how do you help with these patients to be a bit more confident so that they can have a better outlook in life?
I think so From my experience, I guess the communication with the patient and understanding the different profiles that you are attending to will be important. So probably the kind of categories that I broadly can classify will be like maybe a non-working adult, like maybe a student. Then it might be a bit different from the considerations that you have for a working adult, for example, and also for elderly, maybe retired. So their outlooks definitely very different. So I mean, from one end of the spectrum, the young and very rather seemingly healthy young adults might not necessarily feel that this is something that uh, is is um, is something that they are very aware about because how should I put it? In terms of their outlook might be a bit different because they might not have understood the condition very well. Not have that kind of ability to probably they have considerations of like, oh, how am I going to continue care in terms of like cost consideration, or maybe if they have not built up a strong enough social support um, uh, at that point in time. It might be an issue for them if, let's say, we don't come in and intervene at the right time or appropriately. So this profile of patients probably will be more concerned about things like cost or maybe support in terms of social wise. I guess the working adult will have a different set of considerations, like maybe in terms of convenience of the dosing of the medicines, and also whether the side effect profile actually does is going to affect maybe their work, for example. Um, so these are the more common things, maybe classical to the working adults that offhand I can think of. Life expectancy is something that everyone worries about lah, at every juncture, but for the elderly, it's usually a bit harder to tackle because some of them might be a bit nonchalant. They might even have got thoughts of like maybe they have lived enough and it doesn't matter to them if they get to continue the next 5-10 years of their life. Uh, so they are not that easy to that the buy-in is not there for them to adhere to their medicines for that reason. So sometimes the elderly might be the more tricky kind of like patients that we manage. And I guess ultimately, you will need to be also cognizant of which classification you can have in terms of the patient profiles that you are seeing. There are some also who are gonna be coming and disappearing for very long, and you might doubt their commitment to adherence. Those are the ones that are the most tricky, and we really need to engage them actively. From our, I guess we have a rather strong social support from our social workers. Some of them, like mentioned earlier, do house visits for patients to try to understand and constantly try to engage them through phone calls or texts to see how they are coping. So those are some of the more proactive approaches that we have for them. And we have to be also very careful with those who are like the assume they know everything kind of patients. So they might have certain misbeliefs, or like they may think that Google is the solution to everything. They can find all the answers from there. There's one patient I had is just on TCM, traditional Chinese medicines, and they might not necessarily be aware that there's things like drug herb interaction, drug supplement interaction on top of the usual drug interactions that we are looking out for and we have discussed earlier. And if you are talking about the other extreme, there's also patients who are overly concerned. So sometimes they come in tearing, or maybe they might not be as open to discussing with you. So under that circumstance, I guess the important thing is to really be actively listening, or rather trying to provide them with an avenue to voice their concerns, and also to help to reiterate some of the common maybe misconceptions. So sometimes it's really the interaction with the patient that you will find some of the openings that they are most concerned about. And if you're prioritizing those over whatever you have for them, I think it will help addressing those concerns first before you move on to the bulk of what you are there to do, like in terms of education and counseling of the maybe I guess side effect profile or things like that. So identifying the patient's priorities and lifestyle, understanding their lifestyle actually helps you tailor your counseling points accordingly. From my experience. And yeah, so those are some of the, and oh, sorry, maybe just one last part about non-verbal cues. So body language and eye contact, I feel is important. So I think inevitably when we are in a very, very busy environment, the attention that we have directly on the patient sometimes might be a little bit limited. So some uh, uh, healthcare professionals actually will be like typing their way through the whole consultation, trying to make sure that they are documenting everything that the patient is talking about and whatnot. So I think the basic respect and need to show that to the patient that you're also interested to find out what they are uh, concerned about. And actually, more often than not, these priorities, or rather their concerns, are your buy-in. And if let's say if it's addressed well, actually can allow you to deliver your message across with greater receptiveness from the patient. So in terms of that, yeah, things like active listening, things like non-verbal cues, eye contact, body language are, I guess, the key to having a better interaction or with patients. Yeah.
Thank you, Jun Xin. Yeah, I definitely agree with you because I think this is how we can get also all these pointers are especially important when I mean no patient is the same. And I mean this is how we can cater to each individualized patient and also in a way try to show to the patient that we are involved in their step to tackling their health issue as a whole and also to try to promote to them to be more empowered and take charge of their own health as well. Yeah. I think also because we're on the idea of like patient counseling, right? And I think most often in school we don't really deal with some not talking to such patients. Maybe sometimes we don't have that experience, and sometimes maybe we don't have that experience of having such a niche population in where we're probably interning or where we are at. So maybe just in an overview, or maybe do you find yourself seeing that managing HIV AIDS patients with HIV or AIDS differ from managing when with patients that have other comorbidities instead?
Definitely. I think I mean the sensitivity portion has to be balanced well. Definitely you will want to provide them with the with an open channel. I think the open channel of communication is something that usually I try to establish with my patients at the early onset. So at least if there's anything that they run into and encounter along their journey, I mean, offhand, they might look for you for if let's say for example you addressed a concern of like maybe certain drug supplement interaction that you have identified for them that might not be suitable, and subsequently you build that trust for them, you will be able to have that better rapport and that better rapport with the patient, and it will help definitely with understanding their level of literacy, like what are the kind of questions that they're asking you, and subsequently you are able to better tailor what you need to tell them or inform them, because at least you have a baseline understanding of their level of literacy. So this will be the kind of direction that I usually work towards as a steady state, like empowering them and having that kind of independence. so that on their own they also can build up their own confidence that, hey, I can actually manage myself quite well. But of course, if there's any issues that I run into, unclear, or maybe certain things that I come across as new, like maybe new medicine, new maybe new friends, they are recommending certain advice or whatnot, then better to check back with a healthcare professional, be it a physician, be it us, or maybe even one of the nurses, if depending on the spectrum of maybe inquiry lah. So I think this is the approach that I usually have, and it helps to build that kind of rapport. And when they kind of like actively come back to you to ask related drug questions, I think this establishes that connection that you want to build with your patients in the long run.
Definitely, yeah. The connection is really important. With
Mm,
I think most often in school, we also talk about the patient-centric relationship that you have to have with
mm,
your patient, and that kind of promotes them. Yeah. So I think I'll move on to the last part, because I think also many of us were students, or maybe some of us are even young pharmacists. So how at this stage in life, like how else can we contribute to the standard of care in managing HIV or AIDS, or the scene as a whole?
as a whole. Okay, so I feel that the current landscape is pretty much focused on treatment and adherence counseling and all. But increasingly, I guess at least in the Singapore context, we are seeing more expanded roles that pharmacists can play in the whole of not just HIV, but I guess in terms of chronic disease management. So specifically for HIV itself, I think we are also looking into prevention. So provision of things like pre-exposure prophylaxis. And now that we have this scheme called collaborative prescribing in Singapore, where pharmacists or advanced practice nurses can actually prescribe alongside their physician counterparts. This might be a possible initiative or collaboration we can have to move towards prevention. I mean, push forward the idea of prevention in maybe either a clinic setting or even eventually, hopefully, a more community-based setting. I think, I mean, definitely not in Singapore, but maybe other countries might have different various levels of autonomy for pharmacists to prescribe or to dispense. So this might be an area that we can possibly look into. Other than prevention will be, I guess, detection. So we have increasingly, or rather in recent, I think year or two, we have got these things called anonymous self-testing kits that you can get of like community pharmacies or even, I guess, online as well. So this will help to increase the rate, the uptake rate, or rather the detection rates of understanding the true prevalence of our of the HIV landscape. And of course, consistent and committed efforts with education on the adherence portion. And moving forward will be monitoring for those who are already on treatment, definitely, like for side effects, for drug interactions, for yeah.
Thank you, Jun Xin. Yeah, so I think we're almost to the end of our podcast, and I think we learned a lot. I think all the listeners are tuning in and learning a lot from this podcast, where we
Thank
are.
you.
I mean, we are reminded that, I mean, pharmacists also play this pivotal and vital role in in this landscape, in providing the holistic care for patients that may have HIV and AIDS, addressing not only the pharmacological part but even the non-pharmacological needs. Pharmacists continuously assess a patient's challenges, which could be like side effects, polypharmacy, drug interactions, but also considering like social economic factors that may impact their adherence. It's also quite interesting to hear that we sometimes have case discussions in a team, and we definitely collaborate with like many, like, yes, it's an interprofessional multidisciplinary team in, let's say, the hospital or wherever, which healthcare institution that the pharmacist may be. They collaborate with the physicians, nurses, psychiatrists, medical social workers, and even with other pharmacists as well. using evidence-based practices, lab evaluations to tailor to a patient's treatment. And they guide patients in assessing their funding and additional support, and through government policies, social services that may be available within the country. Yeah, I think also adherence is like our bread and butter as a pharmacist or even a future pharmacist.
Certainly.
We need to be reminded that as our bread and butter, we can implement tools. And I think also interestingly, I think this is also the first time I heard it also, because I know about med reviews, med reconciliations, but having drug adherence clinics, and through that, or even through means of just having that patient-centric relationship, trying to empower patients through education, advocacy, and even having the support groups to remind them that they are not alone in this journey. Clear communication is a key. To dispel any misconceptions, any false information. Also helping to address stigma, not only for the patients themselves, but even to the public, and also encourage the self-sufficiency, independency that for them to go along their journey. It's also interesting. Of course, as to continuously update ourselves. That's why we have like CPE and all this. We need to regularly update our practices, not only based on guidelines, but also engaging with other healthcare professionals and pharmacists, and ensures that the care that we provide to our patients, patient-centric, just not one way, but two-way, how we can tailor to them, and also how can we respond to the unique challenges of the different demographic groups, different susceptible populations that they might be, maybe different populations at whichever spectrum they are at, and also to foster better outcomes and improve quality of life. Yeah. So I think that's pretty much it for today. I just want to thank you, Jun Xin, for being here. Your insights today have been very inspiring. I think as we go off in the podcast today, we'll definitely take these learning lessons to where we may go in life, especially as we embrace our patients along the way, and especially with the evolving landscape of HIV and AIDS. Hopefully, as innovators and the next generation, we also find innovative ways to improve the treatment, whether through the adherence, through our counseling, and make a meaningful difference in the patient's life. So maybe as we conclude, what could you share maybe one last piece of advice that you can give to our members?
Okay. So probably the idea that I want to bring across is that having the right approach actually will save a lot of effort and lead to good results lah. So generally, if let's say you are able to empower, I think that's the key that we are trying to push, or rather the direction that we are moving towards, getting the patients to be self-sufficient in terms of basic care needs, and building on that rapport with them to allow them to know when to seek for further advice and to clarify some of these things that they encounter. I think that's our role as healthcare professionals in their journey as well. Yeah.
Definitely. So I hope all our members will be reminded that it's definitely important to empower our patients so they can be independent, and also feel that bond with us as pharmacists, that we are like helping them along that journey. Yeah. So
Yes.
once again, we'd like to thank you, Jun Xin, for allowing us
Thank you for
to
having me.
interview you today. Yeah, thank you. We wish you the best of luck for the future. And for those who are tuning in to this episode, I hope you stay tuned for the next episode, where we'll invite another healthcare professional in their journey in the HIV/AIDS landscape. So this is Julian, Hosea, and Chelsea signing off, and see you in the next episode.